All right, so I'm going to do trach suctioning. So I will start by removing the saline from the kit and checking the expiration date. And I will grab the catheter from the kit and replace the saline. Now with my dominant hand, I will wrap the tube up, and then with my non-dominant hand, I'll grab the wall suctioning tube and connect it up to the catheter end, make sure it's a tight fit. And then I will make sure that the wall suctioning is set between 100 and 150 millimeters of mercury, and make sure that it does not go over 180. And then since this hand is contaminated, I cannot touch the catheter tube. So I'll dip it into the saline to make sure that it is lubricated, and then I will suction a little bit up just to make sure the wall suction is working. And then I will remove the trach collar and O2 therapy from the patient. With the ambu bag, I will give 5 to 6 breaths over 30 seconds with the FiO2 level at 100%. And then I will insert the catheter, making sure to not contaminate it by touching my PPE or the patient's gown, and to make sure I don't contaminate my sterile glove by touching the outer cannula. So when I insert, I will want to not suction while going in, and stop whenever I feel resistance or the patient coughs. Then I'll pull back 1 centimeter or ½ inch, and then start suctioning intermittently. And then I will pull out, taking no longer than 15 seconds. Clean the catheter off in the normal saline. And then I will hyperoxygenate the patient again, with about a minute break in between each pass of suctioning. And as I suction the patient, I will want to check the vital signs, and I will stop suctioning if the patient has a pulse rate that has an increase or decrease of 20, or if the SpO2 level drops below 90% or 5% from the baseline. And then I will hyperoxygenate the patient again and wait a minute. And then I will do a third pass if the patient still requires suctioning. And then after the last pass that the patient needs, I will take the wall suctioning tube off and replace it, and then replace the trach collar after I ambulate and hyperoxygenate the patient. I will put the trach collar and the O2 therapy back on. And then I will keep the catheter in my gloves and go glove to glove and skin to skin.